Hello all, we're from SGD 9 and today we will present you a prognosis aspect of homocysteine serum test for diabetes mellitus patients. So these are our group members.
Hello everyone, my name is Angelina Fritamulia with last three-digit number 051. So now I will explain about the introduction of the student project. So the first one is the background. There is a scenario. A marketing staff from a well-known laboratory came to a doctor to offer a homocysteine serum test for diabetes mellitus patients. The staff said that this new marker homocysteine can predict the mortality rate in patients if the level in serum was high. The doctor asked for evidence for that statement. The staff didn't have the answer for the doctor question. Could you help the marketing staff to search for the evidence from the internet? So diabetes mellitus is an endocrine system disorder that is identified by abnormally high blood glucose levels. It is resulting from lack of insulin and in conjunction with insulin resistance, B cell malfunction, or both. Homocysteine is an amino acid that is produced during the metabolisms of methionine. Homocysteine serum may be a possible indicator of vascular problems in diabetes. It is associated with the risk of cardiovascular disease and atherosclerosis in individuals with type 2 diabetes. However, it is still uncertain if homocysteine serum predicts mortality risk in people with diabetes. Therefore, there is a need for critical appraisal based on evidence base to determine the best evidence of homocysteine serum as prognosis indicator in diabetes mellitus patients. Next is the problem formulation. The first one is what type of question of the above scenario? What is a PICO and how is it used to build a clinical research question? How to formulate a clinical research question from the scenario above? What is the best evidence or journal to answer a clinical question and how can it be searched for? How to apply the critical appraisal to the journal? How can the evidence or journal be critically appraised to determine its quality and meaning? And how can the results of the evidence be integrated with clinical expertise and patient values to apply it in practice? And for the objectives are to identify the type of question from the scenario, to be able to build up a clinical research question using PICO, to be able to formulate a clinical research question from the scenario, to find the best evidence or journal to answer the clinical question, to apply the critical appraisal to the journal, to find out how good the journal is and what it means, and to integrate the results with clinical expertise and patient values. And the benefits of this student project is to understand the formulation of clinical research question using PICO, finding the best evidence to answer the clinical question, applying critical appraisal, and integrating results with clinical expertise and patient value. By understanding this process, it is hoped that we could evaluate the evidence to determine the validity, reliability, and relevance of the research findings that can be used for patient care. Maybe that's all from me. The presentation will be continued by my friend. Thank you.
Hello, my name is Aurelia Sevania Tanto with 3 last student number 137. Now I will explain about the type of question of this scenario. So there are two type of question. First is background question and then foreground question. Background question is concerned with general knowledge and usually available in standard text, while foreground question has 4 components called PICO: patient, intervention, comparison, and outcome. The answer usually not available in standard text, and if it's available, it's no longer accurate. So the answer for foreground question need to be gathered from many clinical literature. Questions about issue in patient care are broadly categorized into diagnosis, therapy, prognosis, and other issues that are related to health, care, or personal. In this scenario, the type of question is foreground question prognosis because they want to look at the predictors of mortality and are specific and directly related to clinical issue. In this case, the potential predictive value of homocysteine level in serum on mortality rate in patient with diabetes mellitus. And also in this scenario, they have an element of PICO. That's all. Next will be explained by my friend. Thank you.
Hello everyone, my name is Chintamigi Mamasela with the student ID number 2002511070 and I'd like to be describing the clinical research question using PICO. So the P patient here is diabetes mellitus patients with the indicator high homocysteine serum and the comparison low homocysteine serum. The outcome is mortality rate. So the research questions here are: in diabetes mellitus patients, does high homocysteine serum level could predict mortality rate better than low homocysteine serum level or not? That's all from me. Thank you.
So hello everyone. First of all, let me introduce myself. My name is Ardelia Clara Budiman with the 3 last student number. So here are several clinical research questions that were made based on the case. So the first one is, in diabetes mellitus patients, does high homocysteine serum level predict mortality rate better than the blood sugar level? And then the second one is, in diabetes mellitus patient, is homocysteine serum level as a diagnosis tool more accessible in local healthcare unit compared to hemoglobin A1C? And next one is diagnosing with homocysteine serum level more sensitive and specific compared to using hemoglobin A1C in diagnosing diabetes mellitus? And the last one is homocysteine serum level are more affordable compared to diagnosing with hemoglobin A1C and blood sugar level? That is it from me. Thank you very much.
Hello, my name is Bagus Putra with last 3-digit number is 219. So here I'll explain about the critical appraisal and the validity of this study. The study investigating the correlation between serum homocysteine level and mortality in adults with diabetes, leveraging data from the National Health and Nutrition Examination Surveys, a nationally representative survey, enhanced the external validity of the findings. The study utilized a prospective cohort design, which involves observing a group of individuals over an extended period to investigate association between certain factors and specific outcomes. In this case, the focus was on examining the connection between serum homocysteine level and mortality in adults with type 2 diabetes. The sample, totaling 2,286 individuals, were followed for a median duration of 11 years. The inclusion of a substantial sample size bolstered the statistical robustness and generalizability of the result, although the exclusion criteria, including pregnancy or loss of follow-up, should be more explicitly justified to mitigate potential selection bias. The measurement of serum homocysteine employs the well-established Abbott homocysteine assays, characterized by a detailed and transparent procedure, including the use of DTT and specific calculation, contributing to the reliability of the measurements. Adjustment for relevant covariates in Cox proportional hazard model strengthened the validity of observed association, and secondary analysis and subgroup stratification contribute to a nuanced exploration of potential heterogeneity, while predictive modeling adds depth to the findings. In conclusion, the study exhibits methodological rigor in its design, data collection, and statistical analysis, while strengths such as the use of a nationally representative dataset, ethical consideration, and transparent reporting of method enhance the study validity. Okay, that's all from me. Thank you.
Hello, my name is Anggia Amanda Tranadevi and my student ID number are 088. I'll continue the presentation about critical appraisal of the journal, especially validity aspect. The well-established Abbott homocysteine assay is used to measure serum homocysteine. It is characterized by a thorough and transparent process that includes the use of DTT and particular calculation, which adds to the measurement reliability. Standardized protocols are employed to collect comprehensive data, which include baseline characteristics, medical history, and medication. This approach strengthens the study ability to control for potential confounders. The use of the National Death Index and ICD-10 codes for cause-specific mortalities introduce objectivity and precision to the study outcomes, and the well-defined follow-up criteria enhance internal validity. Carefully considered weighted analyses are incorporated into the statistical analysis to account for the intricate survey design and ensure nationally representative estimates. Adjustment for relevant covariates in Cox proportional hazard models enhance the validity of observed association. Sensitivity analysis add robustness to the finding and strengthen the credibility of the study conclusion. In summary, the study design, data gathering, and statistical analysis all demonstrate methodological rigor. However, the study validity is increased by the use of a nationally representative dataset, ethical consideration, and open reporting of methodology. Okay, that's all from me. Thank you.
I'm Anissa with the last 3 digits of NIM 110. I would like to continue on the importance aspect of the critical appraisal of this journal. So over a median follow-up period of 11 years, 952 out of 2,286 patients diagnosed with diabetes succumbed to various causes. Among these deaths, 28.3% were attributed to cardiovascular issues, and 15.2% were related to cancer. Utilizing a restricted Kublik spline, the analysis revealed a linear correlation between homocysteine levels and the risk of all-cause mortality. That's all from me. Thank you.
Hello, my name is Laura Kusuma, digit number 178, and I will continue to explain critical appraisal importance of this journal. So those in the highest quartile exhibited multivariate adjust hazard ratios or HR and 95% confidence intervals of 2.33 for all-cause mortality, 2.24 for cardiovascular mortality, and 2.05 for cancer mortality. In serum HCY significantly enhanced the reclassification for 10 years mortality risk in diabetic patients, as evidenced by a net reclassification index of 0.253 and an integrated discrimination improvement of 0.011.
My name is Azam Fadila with registration I number 094. I will explain about the application of the evidence based on clinical expertise and patient value. First, based on clinical expertise. Based on the result, higher serum homocysteine level were significantly associated with increases of all-cause mortality and cardiovascular mortality, particularly heart disease-related mortality. However, there was some significant association found between homocysteine level and mortality specifically related to cancer. In addition, after carrying out stratification and additional analysis, the association between higher serum homocysteine and increased risk of all-cause mortality persisted across various subgroups, even after excluding specific groups like individuals with probable type 1 diabetes or those initially diagnosed with diabetes. That's why the use of serum homocysteine to predict mortality in diabetes mellitus patients can be used.
I am Henry Kamaria with United in patient value, we are looking by at in patient category. And then consider the cost and variability and benefits of homocysteine examinations to predict mortality in diabetes. In the study, and we approach the rating system, the algorithm is carried out with respect to the rating alternative.
Hello, my name is Bertrand Matthew Jaya with last digit number 132, and I'm going to explain about the conclusion. From the literature review conducted by our small group discussion, we identified a linear correlation between elevated level of homocysteine serum and an augmented risk of both all-cause and cardiovascular mortality among individuals diagnosed with type 2 diabetes mellitus. Hence, we can deduce that the homocysteine serum test can be used as a potential biomarker for evaluating the mortality rate in patients with diabetes mellitus. That's all from me. Thank you.